Hello and welcome back. As mothers and as birth doulas and as healthcare providers, we all have one goal, and that is healthy baby and healthy mom with as quick a labor as possible with as low amount of pain as possible, right? Okay, so today I have to share with you one of the best ways to do that, and it's through your labor positions and your birth positions. So we're gonna dive into this a little bit. And one of the first things I have to tell you is that depending on where you're giving birth at and who your care provider is, that is going to make the biggest difference in what kind of labor positions you have and what kind of labor you have. For example, if you're wanting as natural a birth as possible and you're wanting to give birth up on your hands and knees, but your OBGYN is like, I want you in the hospital bed and on your back with the feet in the stirrups, then when it comes time to actually give birth, if your OBGYN is pretty set, then most likely you're going to be giving birth on your back with your feet in your stirrups, okay? So just know that your location and your care providers those two things are gonna make the biggest difference as far as where you labor at, where you give birth at, and what your experience is going to be like, okay? Know that instead of one position that's best for everything for your entire labor and birth, changing positions is what is going to be best. The more you can move, the better off you'll be and change positions. So there's a book that I love. This is called Active Birth. It's by Janet Velasquez, and it is so super helpful with all kinds of birth positions and just really the why behind it. It has tons of images, and it also includes all kind of stretches and yoga and everything to be physically fit for the best delivery possible. So I did reference this book quite a few times in the making of this video. Again, it's just an excellent resource. And one of the biggest things that you need to understand with your labor and birth positions is what your baby is doing, okay? So as your baby descends, she's going to hopefully be over on your left side, okay? And ideally, and she's going to turn and she's going to rotate as she comes out and moves down through your hips, okay? So here is your pelvis and here is your tailbone, okay? And when you're on your back giving birth, then all of the blood vessels are squished and there's pressure on your tailbone, and it's really a narrow opening for your baby to get out, as well as you don't have gravity working with you, okay? But as soon as you sit upright, get on your hands and knees and change in, any upright position, then your tailbone will actually lift up out of the way. We can do that hip squeeze and show you there's actually more room when you squeeze the hips, and when you're upright and that tailbone moves, the opening widens significantly by, 30% more for you to be able to push your baby out, okay? So keep this visual in mind as your baby descends and turns and comes down through. Your baby's going to be moving and changing positions and turning. And so if you do the same, it's gonna be a lot easier on you, less pain for your baby, or less pain for you, well, and your baby too. Yeah, totally awesome. So I wanted to read you some of the benefits of an active upright birth, okay, versus laying down in the bed on your back and never moving, okay? Less discomfort and pain for you. The uterus functions better, so you don't really need the artificial stimulants and the drugs. Those aren't really necessary if you're upright. Okay, your labor is going to be shorter, less need for forceps or vacuum extraction. The secretion of your hormones, we talked about this before, all of your hormones are going to be regulating right, and that's not going to be disrupted if you're upright and moving. Again, your blood vessels aren't going to be compressed, so there's more oxygen for your baby, greater opening of the pelvic outlet, more help from gravity, maximum relaxation of your perineum, so that you don't tear, so that you can stretch beautifully. Your contractions are gonna be more efficient, and the whole thing is just gonna work so much better. Okay, so movement. What are the best ways for you to move during your labor, okay? And I brought a birth ball with me, okay? A birth ball is an excellent way for you to move during your labor. it is going to open up your hips, it's going to widen everything, and it's going to move that baby down exactly where we need her, okay? I don't know if you can see, but even like circle 8s on the birth ball, even rocking back and forth, going in circles one way and then circles the other way, it's an excellent form of movement during your birth, okay? Another form is just walking. Walking is excellent during your labor. If your hospital will let you walk the halls, if you can walk your own hall in your own home, whatever works for you to be able to move. Now, what do you do when a contraction hits? So let's say you're walking and the contractions come and you need to be able to relax during the contractions, right? The more you relax, the more you sink into it, the quicker your body is going to open up and you're going to get baby here, okay? So hopefully you have a doula or a mom or a husband or somebody with you. And as you're walking, the contraction comes, you can actually put your arms up around their neck and just let your whole body weight like sink into it and leave all the weight on the other person, okay? Relax your body, deep breathe through the contractions, and then you can get up and walk some more and get that movement going. Is swaying your hips, even dancing, okay? All of that is going to get your baby moving down where you need her to be able to be born, okay? Let's see if I missed anything. Yeah, again, standing, walking, all of that is excellent. Another really great position to labor in, it might seem a little odd, but is having labor on the toilet, okay? It might seem odd, but again, like the birth ball, your hips are opened up and you can completely relax all of those muscles, okay? Anything, including your baby, can come out, which just lets you like relax. And you can take pillows, stick them on the back of the toilet, stack it up and lean forward and just completely sink in and let your body relax and sink and surrender into those contractions, okay? So forward facing or backwards facing the toilet is an excellent place to be able to relax and to labor, okay? And don't worry, you'll be able to get off before you give birth. It won't happen that fast, okay? So keep that in mind. The toilet is excellent, okay? Now, sideline. This is really good if you're feeling exhausted, if you need a break, change it up for a little while. Sideline is excellent. If you got a peanut ball, those are good. I bring mine, or our care providers might have one. This is really good between your legs, so you can lay on your side, maybe propped up on some pillows, and then you can put the peanut ball in between your legs, and it just keeps your hips open and everything working right, okay? Rotate from side to side. You don't want to stay on one side too long. Like every 45 minutes, you want to be up and moving and rotating. That's going to make your contractions less painful. It's going to make your labor quicker if you're continuing to like move and change positions and keep going, okay? Now, when it comes time to give birth, this makes, you can actually give birth on your side, no matter your location. This just under your arm like this is really good to lay on your side. And then, I'll probably make a fool out of myself trying to show you, but you can, when you're laying on your side, you can actually take your arm, curve it up behind your leg like this, and pull your leg up to be able to give birth, okay? That is an excellent position to give birth in, is laying on your side, okay? You don't have so much gravity working with you, but it still lets your tailbone open up, your pelvis open up, and gives you the ability to rest in between contractions too, if it's coming really, really strong, okay? The next position that's really good to give birth in is the squatting position, okay? Now, squatting is excellent. It's gonna give you maximum pressure inside your pelvis, minimal muscular effort. It's also gonna give you optimal relaxation, optimal oxygen supply to your baby, and then you get gravity working with you too, right? Okay, so squatting is excellent position to give birth in. Now, with that being said, it can get really tiring really fast, okay? And by squatting, let me see if I can show you here. I just mean like squatting, okay? Now, you want to do this as much as you can through your pregnancy because that's going to help you come baby day, okay? So when you're picking up toys and when you're picking up children and when you're watching television, you want to sit cross-legged and just keep that opening going as much as possible, okay? Now, with the squatting, like I said, it can become really exhausting really fast. And this is where your doula, your husband, your mom, anybody can come in really, really handy again, okay? So you can do the squat like we talked about before, where you're standing and you just squat and relax during the contraction. You can also have them come behind you, put their hands up under your arms right here, and you can just lay back and open your legs and lay back and squat that away through the contraction, even through the pushing stage. They can also support you through your squat as they're sitting on a chair or the edge of a bed, and give you support that way. There is a squat that I love with two supporters, where you have like your doula on one side and your husband on the other, and they're both supporting you, kneeling and supporting you while you squat. Okay, so one on each side. Same thing, you can put all of your weight completely on them and just give birth to your baby and just relax and work on the pushing stage, right? That would be an excellent position for pushing, okay? The last one I'm going to share with you is kneeling or on the all fours position. This is really, really good if you're experiencing any kind of back labor, if you're feeling out of control, to be on your hands and knees. You can sway your hips back and forth in between contractions or as you see fit with pushing. You can put something soft under your knees. You can do this on the floor. You can do this on the hospital bed. Even if you've got an epidural, you can give birth on your knees on a hospital bed. I've seen it done many times. And this just, I really love the hands and knees position because it really gives you a sense of like control and empowerment, like where you're able to put like all of your energy into it. And again, it's gonna allow really good opening of your pelvis, okay? Now, if your hands and knees are like this, you can also kneel on hands and knees like this, where you're upright a little bit, and that's gonna get gravity helping you too as well. So that's probably like my favorite position because you can really get into it, all right? Let's see. Now, I wanted to say a few things about pushing. During labor, all of your concentration and your efforts revolve around like, okay, I gotta relax and I gotta surrender, and you're just deep breathing and you're just there, right? But when it comes to the pushing stage, you actually get to like get up and like do something and actually push your baby out, okay? And it's really like empowering. You don't just have to like wait anymore. So this is what I like, when you can do something, okay? So ideally, you wait till you're completely dilated to a 10, because you don't want to be pushing any sooner than that. And ideally you can like feel and push with the contractions rather than someone just saying, okay, you got to push now, like, or you got to push now. Because when the contractions come, then your body's already working to push your baby out, and then you just kind of give it that extra little zing it needs to be able to do what it's supposed to do. So you're gonna take a deep breath, you're gonna tuck your chin, and you're gonna push, okay? And ideally, depending on the length of contractions, you can push for about 10 seconds, rest, take a deep breath, and then go at it again. And you can even get like 2 or 3 really good pushes in before the next contraction comes, depending on, how it's going. The length of the pushing stage totally depends on you, your baby, your position, everything, the size of your baby. So it really just varies. Sometimes the pushing stage is really long and it's really intense and pretty dramatic. Sometimes the pushing stage is like, boom, and there's your baby. So there's a lot of factors involved. There's not one set way of knowing, even from birth to birth, with the same mom, the pushing stage can be completely different. So one of the things that I absolutely love that is like your secret weapon, I don't have it right here with me, is Helichrysum Essential Oil. Now, Helichrysum is gonna help stop bleeding. It's gonna help with bruising. It's gonna help your tissues stretch and your skin stretch. It's gonna help with healing. It might help with the bruising of your baby's head. So take 20 drops of Helichrysum Essential Oil, mix it with 4 tablespoons of warm fractionated coconut oil would work. Also olive oil will work. And you're gonna have someone apply that all over to your perineum prior to the pushing stage, okay? That is going to help everything go smooth, and so we don't have to have stitches, okay? Helichrysum is freaking amazing. Worth every penny. Okay, get Helichrysum. That's gonna help you through that ring of fire we're talking about, okay? The ring of fire is when you feel the pressure and the push and the burning sensation around your perineum. Helichrysum is your go-to. Get it, use it, you won't regret it. Okay, now when your baby starts to crown, that's when her head is starting to come out. You can see the little hair in the top of the head. That's that very first visual. You can reach down, you can touch your baby's head. A lot of times that will give moms the extra oomph they need to keep pushing and keep going. It makes you really feel like you're getting somewhere and that you're making progress. You're not just gonna be in labor forever. So yeah, that's a great thing. Make a plan, and ideally this is how you want your labor to go, but then be really open to suggestions from your doula, your care providers, because maybe what you planned, when you get in that moment, you find yourself like, no, I need to do something different. I need to change positions. And if you learn to listen to your body and really tune into it, you'll know what you need in that moment. You'll know what position you need to be in, and you'll know what you need to do to birth your baby in the best way possible. So that's all I have for you today. Best wishes with your labor, birth positions, and with pushing.